And now, our next guest with a recorded video is Dr. Geethu Balakrishnan.
First of all, I'm very much happy to be part of this wonderful event, and I take this opportunity to express my sincere gratitude to all the organizers of the event, especially Dr. Thomas sir, for giving me this wonderful platform. I was lucky enough to be part of this conference 2021 also. And first of all, thank you. Human body still remains an enigma with its complex and chaotic system characterized by irregularities and unpredictabilities. And also it's being non-linear for its every aspect of physiology and pathology, and this being always being a repository of probabilities, there are always chances of permutations and recombinations. Such an uncertainty is well reflected in every aspect. I feel that even for the treatment aspect also, as alterations in the pursuit of vision, starting from the very first microscopic reductionistic approach to the recent approach of magnified holistic approach. And what I felt is this is very much evident in the recent years for the paradigm shift happened for the disease causing theories, starting from the very first germ theory to the recent concepts of oxidative stress theory and free radical theory, etc. Also, and every pathology trails a chronology for its inception, of which autism is of no exception. And when we look into the history of the advancement of the disease, it was initially being pondered as a mere psychiatric disorder of schizophrenia, and it took over these years to reach the current status of autism spectrum disorder. Also, and it was with all these in background, a team of researchers embarked, including me, embarked our journey of inquiry, which eventually ended up in this clinical trial as a microbiome, which finds out human gut microbiome as a potential factor in managing autism spectrum disorder. So for the next 15 minutes, we will be discussing on this clinical trial. And autism spectrum disorder, as you know, is a lifelong neurobehavioral disorder which has been reported with an incremental surge, and this is being unanimously reported by CDC, that is Center for Disease Control, World Health Organization, with prevalence of 1 in 100, 1 in 54, etc., etc., etc. Also, along with the huge parental stress affecting the family relationships and environment, it has hiked up to the status of a global burden, exerting much adverse economic impact. And these are some of the statistical data on the expenditure being done for the management diagnosis of this is in most of the developed countries. And it's in this scenario, when the whole world is tumbling in the gloominess of autism, let's have an overlook onto the dependency of the common mass on complementary and alternative medicine, making upon 80.9%. And though it's been a victim of virulent debates on etiologenesis, and also still till date, we couldn't find a reliable biomarker for the treatment of the condition, and still continues as a matter of speculation. Also, there are recent conventions on invariable connectivity between the traits of autism and dysbiosis under the heading of gut-brain axis. Moreover, there happens a springing up of probiotic industry in the management of this, and this all with all these in background, we could come to a conclusion that that is the gut microbiome, or the gut itself, is a potential, or to be more specific, one of the most influential modifiable factor in the management of autism. Also, the crux of Ayurveda principles have always given importance for the gut health in both etiopathogenesis and management of any of the pathology. So here we are with the first evidence-based clinical trial connecting autism, gut health, and Ayurveda. Moving on to the aim, this trial was being aimed for assessing the efficacy of a gut therapy protocol, which was being developed in the management of autism features and to assess the dysbiotic changes of gut microbiome in children who are suffering from autism. And the long-term objective was the formulation of a non-linear comprehensive perspective model for the management of autism. And this was being conducted as being supported by the government of India, that is the Ministry of Ayush, Ministry of Ayurveda, Yoga, Naturopathy, Unani, and Siddha and Homeopathy. This is a funding agency, and this is being registered with the Clinical Trial Registry of India. The assessment criteria used were CAS scoring. It is some almost 15 heads were being assessed in this CAS scoring. This is usually used scoring for assessment of autism, that is childhood autism rating scale. And we developed an Ayurveda gut health questionnaire, which was also being used as an assessment criteria. And for the stool samples collected for the initial screening and after 1 month, that is for the 1 month after 1 month of treatment and after 1 month of follow-up, the stool samples were collected and 16S RNA sequencing was being done. And also GI severity index was used for the assessment. And all the parenting figures of children diagnosed with autism based on DSM-5 criteria between the age group of 3 to 12 years without discrimination of sex, religion, and economic status were included in the clinical trial. However, all the children with any of the comorbid conditions like cerebral palsy, mental retardation, or any other sufferings like coma, paralysis were excluded, and all the children on any of the medication, including anti-epileptic medications, as usually epilepsy is one of the common comorbid condition usually associated in autism children, or children on probiotics or any long-term or recent antibiotics or any other medications from any of the stream of the medicine were excluded from the trial. Moving on to the methodology, the entire trial was conducted in 3 phases as baseline, interim, and follow-up phase. In the baseline phase, based on the inclusion criteria, we have screened for about 60 patients, and they were selected and they then were randomized into 2 groups as control group and intervention group with 30 participants in each based on simple random sampling technique. And in the interim phase, this is where we give all the intervention. This was the phase where we give all the intervention, and for the 2 groups we give intervention, that was multimodular intervention with 2 months of speech therapy, occupational and behavioral therapy, along with parental guidelines for food and lifestyle modifications for both the groups. However, for the intervention group, additionally, we have given 1 month intervention using Ayurveda medicines. That is, these include 2 polyherbal Ayurveda compounds. That is a powdered form of Rajanyadi Churnam, and the other one is a pill or a capsule or a tablet form, that is known as Vilvadi Guliga. These 2 are 2 time-tested Ayurveda drugs which are being commonly used in the country of India for treatment of, and these 2 are time-tested drugs. And in the follow-up phase, we have done the assessment criteria, which we have already discussed, and this was done on the screening day, that is 0th day, and after 1 month of treatment, and on the 60th day, that is after 1 month of follow-up. These are the methodology in detail, wherein we have done the screening, allocation, protocol, intervention, assessment. And in the interim phase, as we have already discussed, the 2 polyherbal medicines were being administered for a duration of 30 days, and these were done thrice daily, 30 minutes before meals, along with lukewarm water. Also, both the groups, that is the control group and the treatment group, were being given with a prescribed and structured food and lifestyle guidelines based on Ayurveda epistemology during this duration. And moving on to the results from the test of within subject effect for overall gut health assessment done by Mauchly's test of sphericity, we could found that the time treatment interaction was found to be very much effective, which means that the changes happened during this clinical trial was not caused due to the factor of time. Also, from the results of test of within subject effect for the different measures, as already discussed, there are some 15 headings or points we assess under this childhood autism rating scale, and it was found that the mixed model ANOVA time treatment interaction was found to be effective with p-value less than 0.005, which means that significant effect of treatment on total score was found. And this was the profile plot for the overall gut health assessment done for both the control and intervention group, plotted against time. And this was for the GI overall results plotted against time. And the two table of means for overall gut assessment was being statistically analyzed, and a significant increase in the mean score of overall gut assessment in the intervention group was obtained when compared to control group. And from the output, it could be inferred that this Ayurveda intervention along with lifestyle guidelines can lead to positive impact in the gut health status. Also, for the summary statistic for the different measures, it was found that through CAST, significant decrease was obtained in the mean score of the intervention group when compared to control group with p-value less than 0.05. You could see that initially it was 46.393, and at the time point 3, that is after 1 month of treatment and 1 month of follow-up, this came down to 40.625 in the intervention group. And for the result of GI severity index, a repeated measure ANOVA with greenhouse gas correction was assessed, and the estimated marginal mean in control group showed a reduction of 1.06 points, while in the intervention group, the reduction was 2.9 points from the time point 1 to time point 3, indicating that the effect of treatment was far better in intervention group compared to the control group. A groundbreaking blow away to all the existing pathologies was done by biologist Alana Collin in her best-seller book entitled 10% Human. And she was purposefully given this name of 10% Human, estimating the presence of a third player which sits uncomfortably between nature and nurture, the microbiome. She bases her book title as 10% Human on estimation that the human cells in our body are outnumbered by microbial cells 9:1, making upon 90%. And it was with this riveting focus on the intricate relationship between human body and microorganisms has drawn our attention, eventually ended up in this clinical trial. Moving on to the results of the microbiome, results of the 16 srRNA sequencing of stool samples. While comparing the top 10 genus obtained before and after treatment, we could found that there was an increase in the presence of the beneficial bacteria of Bifidobacterium and a decrease in the presence of the harmful bacteria or pathogenic bacteria of Clostridium. And this difference in the microbiome marker points onto the establishment of a well-balanced possible establishment of a well-balanced ecosystem that is without affecting the co-location and co-functioning of microbiome. And also the microbiota diversity analysis was being done based on alpha diversity and Shannon matrices. Also the heat map for top 25 genus and 25 phylum was also being calculated. And this was the alpha rarefaction plot, which was being, which is known as the gold standard to appraise the diversity of species within a sample, was also being done using the common matrices to know the evenness and richness of the species. And also the both weighted and unweighted unifrac TCIM plots to analyze the beta diversity using the distance matrices was also being done. And however, till date, the most recent approaches known for the management of this dysbiosis is fecal microbiota transplantation, that is FMT, and probiotics. However, we could see that in FMT, the replacement is being done only with the beneficial bacteria. And also, in FMT, dominance of highly pathogenic bacteria is being reported, and in prebiotics and probiotics also, the replacement is being done only with the beneficial bacteria, caused much distortions to the naturally existing co-functioning of species. So the whole world, what we felt is that the whole world is in the search of a midway, an alternative for this existing dilemma, for the establishment of a well-balanced ecosystem, and an inkling from this thought fueled our curiosity has made us to undergo the 16S RNA sequencing event for the Ayurveda polyherbal compounds to uncover their beauty, and most astonishing results were revealed for us from this results, as we could found that these two drugs too encompassed the presence of pathogenic bacteria. However, till date, not a single catastrophe or any of the comorbidities have been reported related to these two time-tested polyherbal compounds. And more pragmatic and empirical attestations on this could be obtained from this, that is the annual turnover of these two time-tested drugs for the year 2020 to 2021, the state of Kerala, which is just one state in India, and the annual turnover of these two time-tested drugs is 2,12,450 units for Vilvadi Gulika and 2,32,500 units for the powder, that is Rajanyadi Churnam. So we could found that we understood that health and ill health need to be assessed clinically, then always trying to be assessing that based on the microbiological point. So, and there are a lot of factors having invariable connectivity to dysbiosis, and Bruce H. Lipton in his book The Biology of Belief have mentioned about various factors having invariable connectivity, and he had concluded that all these factors could be encompassed to the four domains, that is the thought process of individual, environmental factors, food and drinks, and activities of daily living. And we found that this falls within the vicinity of the recent concept of epigenetics. And the recent approaches of lifestyle medicine has observed these same factors like healthy eating, mental well-being, healthy relationship, physical activity, minimizing harmful substances, and sleep as the 6 pillars of health. So to conclude with, this tested protocol was found to be highly effective with statistical significance in improving good bacterial colonies and to reduce the harmful bacteria colonies, helping to maintain a healthy bacterial equilibrium, resulting in the proper management of dysbiosis in children with autism. Also, both the time-tested drugs of Vilvadi Kulika and Rajanyadi Churnam shows high abundance of several organisms which are in equilibrium of healthy ecosystems so as to manage the dysbiosis in children with autism. So these are the references, and I take this opportunity to express my sincere gratitude to my team, my workplace, that is Kerala Ayurvedic Kottakkal Ayurveda College, and all the authorities. And once again, I take this opportunity to express my sincere gratitude to all the organizers for giving me this wonderful platform, and hope to see you in the next World Health Congress too. Thank you. Thank you, one and all.
Dr. Balakrishnan is connected with us over Zoom. If anyone would like to ask her any questions.
I don't know. Thank you so much. I don't know your name, but my question is, because that was a trial, I don't know if she's hearing us.
Yes, sir. It's audible. I'm here.
So you had 3 phases, which was baseline, intervention, and follow-up.
Yes.
First, I want to know, did you have any drop in any of intervention or control group in the follow-up stage, which may affect your statistical analysis? And the second question is, what were the main challenges, especially in the intervention stage for you? Because definitely, as you know, the intervention stage is important because address your objectives, which is to measure the effectiveness of the intervention? I just wanted to know about these two questions. Thank you so much.
Yes, sir. Thank you for your questions. Yeah, there were really dropouts were there during the study, because during the answer for the second question is, were there mainly any the hazards we faced during the trial? Yes, and that too was that some of the patients, especially autistic kids, they are of mainly of low immunity, and gastrointestinal diseases are very common in them, and they are bound to infectious disease very frequently. So for almost some 4 or 5 patients, we could see that they have to drop out this, and since they were on antibiotic medications, so we were supposed to drop them from this protocol, because you could see that in our exclusion criteria, we have kept that any of the children having any of the intervention were excluded from the trial. So some 4 or 5 patients were excluded.
Thank you for your answer, doctor. Any other questions? Okay, so thank you very much for your presentation.
Thank you. Thank you.